Hello and welcome to Healthcare IT Today, where we explore the latest trends and interesting stories from the world of health IT. On today's episode, I'm going to dive into one of my favorite topics, which is exploring reports that are coming out from organizations that are in the know in healthcare. And with me today is Everton Santos, the Vice President of International at KLAS Research. Everton, welcome to the program.
Thank you, Colin. It's a pleasure to be here with you. Thanks for the invitation today.
Yeah, I'm excited because you guys, or KLAS, basically came out recently with a new report.
Right.
And I always love KLAS reports, I got to say. So you came out with the Global Non-U.S. Patient Engagement 2024 report.
Yes.
And you were looking at a lot of things outside of the U.S., which is really interesting and very neat. And one of the things you found outside of the U.S. was that there's a real focus on patient health information transparency and access to care. What do those two things mean outside of the U.S.?
Let me take you back, Colin, to 2023, where we published a global HIT report, a global report where we look at the investments being made into healthcare IT. And as a result of that report, we learned that one of the highest priority of investments for non-U.S. health systems is digital health.
Okay.
So we got back to Salt Lake and we met as a team. We got to do something about digital health and patient engagement. If this is a high priority of investment over the next 12 to 24 months, we have to understand how are these priorities being assessed today and where they are, and what regions of the world that health systems are looking to invest into patient engagement. Fast forward 12 months later, we were privileged to publish this report where we learn a lot of new details where investments are being made into patient engagement.
Okay. And what does access to care mean outside of the U.S. continent? Does it mean the same thing as it means here to us in the U.S.?
They're not quite as developed as here in the U.S. There has lots to do, or there's a lot of grounds to cover when it comes to making it more patient-centric.
No.
Whereas here in the U.S., we have made some strides, and when it comes to being more patient-centric, we're not quite there yet. But I would say that certain markets are more on the front lines than others in terms of speeding here those initiatives when it comes to being more patient-centric. So the global patient engagement helps us to understand where we are from a non-U.S. perspective in better engaging with our patients, be it with the portals, self-scheduling, the digital front doors, and then we can go into the specifics. But that was the idea. Because of the Global HIT Investment Trends Report published in 2023, we learned that digital health was a high priority, and now we explore a little bit further on what those priorities are for digital health.
Now, this report has some pretty interesting results. I mean, what you found in the EU is that portals and self-scheduling are top priorities.
Yes.
But in Asia, you found it was portals and patient self-check-in or patient check-in technologies. I got to ask this, why were portals so high in those countries?
It's extremely important. There's not really a national portal today per se. For example, in the EU, you have a few private vendors that offer the patient portals, but a lot of health systems are relying on their EHR vendors to provide those portals. And patients are hungry for having some sort of online platform where they can see not only their lab results or their blood tests, but going beyond that and really seeing their medical history and being able to check in for their appointments, schedule their appointments, pay their bills, for example. If you look at emerging countries like in Asia that you're talking about, the ability of really not having to call a call center to schedule an appointment is extremely important for them. And health systems are realizing that, especially on the private sector, in order for them to retain those patients, they have to evolve. They have to innovate. And patient portals and registration self-check-in is one of the key elements for them to be able to not only retain existing patients, but also being able to find new ones.
Now, I have to compliment you because you carved out a special section of the report for Canada, which is where I'm from.
Oh, good.
I'm based in Toronto. So thank you for bringing up Canada.
We love our Canadian friends up north.
Thank you for saying that. But what I found interesting about the Canadian context is that patient communications was one of the most high priorities and most invested. Portals was close behind, but it was actually communications that was higher. Why do you think that was in Canada? That was so high?
Canada, as you know, you've been Canadian, it's a social medicine there, right? So being able to better communicate, increase that in communication between health systems and patients is crucial because oftentimes we see patients that are waiting for a long time to get services rendered to them. So being able to have that better communication is important. What we learned in Canada too, interestingly enough, out of all the other regions, Canada is the only region that rely heavily on their EHR vendor when it comes to patient engagement, patient portals, and the communication aspects. There's not a lot of emerging vendors coming out of Canada, so they rely on the major EHR vendors that are prevalent today in the Canadian market.
Very well said. You definitely understand the Canadian market.
No.
I have to ask you, Everton, were there any parts of the report, any of the results that really surprised you?
There is an online platform that's widely used for text message outside of the North America. It's called WhatsApp. You may or may not have heard of WhatsApp. What we learned that something that surprised us that a lot of health systems in emerging countries like Latin America, I'm thinking of Brazil, or in the Middle East, for example, in Saudi Arabia or the UAE, or in Asia, so a few countries in Southeast Asia are leveraging platforms such as WhatsApp, or in India, to help them to better engage with their patients, be it with a chatbot, be it with a self-scheduling or confirming appointments. That's something that was really surprising to us, that we didn't realize that WhatsApp was playing a huge impact in healthcare. So that's something that was really surprising for us in those three regions, that people are not using just WhatsApp for texting their friends, but also for healthcare.
Interesting. Any other results that were surprising for you?
I think the level of investment, if we look at what we're trying to understand, Colin, at this report is how much health systems are looking to invest over the next 12 to 24 months in actual dollars. So if we look at the European region, the median investment they're looking to invest into patient engagement initiatives around $874,000 US. Wow. Over the next 12 so that's prevalent, right? If we look at our Canadians up north, we're looking about $300,000 to $400,000 US, right? So it's a bit about half of the cost. But we go to the Middle East, that's about $500,000, about $500,000. So you have those discrepancy where you see some regions are more prone to invest more into patient engagement initiatives than others.
So what, do the results that you found internationally have any impact or bearing on health IT companies that are based here in the U.S.? In other words, are there some opportunities that maybe the U.S. folks can take advantage of? Are there some are there some leading or lagging indicators that you can point us to?
There's a lot of regions in the world that look to the U.S. as a beacon in terms of healthcare IT.
Okay.
And let me explain a little bit more on that. They understand that the U.S. usually is one step ahead when it comes to developing new technologies. They do also understand that our medical system here in the U.S. is very expensive. And we rely a lot on public funding to cover those expenses in the U.S. specifically, right? So companies that are currently playing in the U.S., a lot of health systems outside the U.S. look, okay, who are the major companies in the U.S. that offer, for example, patient engagement initiatives that we could potentially use here, and do they have an appetite to go to our markets? One of the challenges that U.S.-based companies, I should say, have in penetrating new markets is localizing the product to cater to the needs of to serve the local population. So that's one of the prevailing challenges. So I would say if a U.S.-based company is able to crack that code and really be able to localize to cater to the specific needs, the regional needs, then that company will have a better success than someone that's not localizing. And they will have also the know-how and experience bringing from North America to help those markets to better engage with their patients. Because once they look at for companies outside of their regions, they usually oftentimes will come to the U.S. to see who are the leading indicators there, who are the main vendors that you track at KLAS, for example, in patient engagement initiatives.
And when you say localize, I think it's very important to say it's not just localizing language.
Oh, no.
No, it's also understanding the billing, how
the revenue billing, insurance, the coding, everything. It's not just the language. Language is one of the factors. It could be applicable for some regions, but oftentimes if you have an English, that's fine, but it's not just the language. You're absolutely right.
Amazing. And it's interesting that you say that basically the U.S. is seen as sort of the leading in terms of technologies, but you do have to regionalize it, otherwise you won't be successful in those countries.
No.
That's really good. So, Everton, you've shared a lot of great information with us today. Where can people go to download this report and learn more about KLAS?
So as you go to KLASresearch.com, we have a portal there on the reports that will allow you to look at the latest report and looking for patient global non-US patient engagement. Health systems providers, you have complimentary access to this report, so feel free to go and download it and digest that report. Healthcare vendors, feel free to contact me and I will be able to get you that report.
Great. Everton, everyone in KLAS is always such a great resource. Thank you for coming on our program today.
Thanks, Colin, for having me. Appreciate it. Thank you.
Hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.